Good morning, everybody. Sorry about the slight delay there, just some technical difficulties. My name is Jess, so I'm a pharmacist based out of Canberra, and I'm super excited today to be able to speak to you all. Keep your questions coming. I've got a few really good questions we've already received in anticipation for this little talk. But if you've got some pressing questions, I think there is a link underneath that you can click onto to send your questions directly to Satna, who's going to get us all sorted. So I'm just going to shrink my screen a bit so you can look at something slightly more exciting. I'm just going to pop myself over here in the corner. Yep, that has worked. Beautiful. So I've been asked to speak to you today about side effects of glaucoma medication. So I work as a pharmacist, and we get lots and lots of questions about side effects for all kinds of medications. And what we want to do is we want you to feel comfortable coming to us and asking whatever questions you might have. There are absolutely no silly questions. We always appreciate that asking questions can be quite difficult for patients. So we want to try and make it as as non-judgmental as possible. So if you really want to ask me any questions today, we're just trying to keep things fairly general here, but your community pharmacist is a fabulous person to touch base with as well. So we'll just move along. So conflicts of interest, obviously this is for everybody who's online today on the Facebook Live. So I'm obviously not speaking about specific cases. However, this is in a general nature. So part of our job as pharmacists is to work with your whole team. So that's your GP, your optometrist, your ophthalmologist, and I apologise to the GPs out there that I have not put you on this slide. My apologies. So I don't have any other conflicts of interest to declare. I just work as a community pharmacist and occasionally as a dentist, but we don't go poking around in eyes, so that we'll leave that on the side today. So a little bit about where the pharmacist fits in the picture. So I'm sure plenty of you have had lots of interactions with us, and hopefully they're mostly positive. So we manage medication. That's a core part of what we do as pharmacists, and we spend a lot of time learning about drugs and learning about how to get the medication to where it needs to go to do what it precisely needs to do for the patient. So the other thing that we do is to support you. And that's the thing that will change. It's a bit like what Glaucoma Australia does for you as well, is at every stage of your journey, what you need from us is different, and our job is to support you in that and to make sure that you're comfortable and you're empowered to take, to take the leadership and ownership of basically your health. So glaucoma medications, just as a quick introduction, is basically they fall into two primary groups, and without making things overly complicated, you basically have medications that can reduce the amount of the aqueous fluid that's in the eye. And you also have the second type of medications where they increase the flow of the fluid out of the eye. So these are two ways that the medications work, and sometimes patients will have just one type of medications. Sometimes people use a combination of different types of medications to get the right mix. So how I explain it to patients is it's not a one-size-fits-all. It would be really great if only one medication could fix everything, but that's just not how it works. And sometimes it just takes a little bit of investigation and trialing to get the right combination for that specific patient. So everyone loves asking me about side effects, not just with glaucoma medications, but with all medications. And when I first come out and talk to someone about, this is a new medication, I always encourage people to start reading their information leaflets from the beginning. I know the reality is most people zoom right to the side effects section of the information leaflet. So the reason I encourage people to start from the beginning is because it gives you a bit of context. But seeing as how we're talking about side effects today, so they can be classed into two kinds of side effects. So just because we're putting primarily medications into the eye for glaucoma doesn't necessarily mean that you can't get side effects that can happen everywhere else in the body. Um, Most effects are local, so they're limited mostly to the eye because that's where we're putting the medication. But occasionally you can get side effects that can affect other parts of the body. Um, Most common side effects with the eye is you can get a bit of irritation. I'm sure many of you use eye drops, and you can sometimes feel that there's a little bit of a sting or a little bit of irritation occasionally using the eye drops. Most of that tends to be transient. The other thing is obviously blurring. We're putting eye drops into the eye, and sometimes you can find your vision can just blur just a tiny little bit as you're putting the drops in. The other thing that I always talk to patients about is how to put in the eye drops properly. I know our optometrist and ophthalmologist colleagues are fantastic in walking patients through this, and it's something that I've worked with a lot of pharmacists in our group to make sure that they can explain to patients how to do this properly. Part of the reason is if you put them in properly and you've got good technique, you're less likely to get absorption, which means that you're less likely to have these systemic side effects. So this is the technical component. I try not to put too much stuff onto the slides so that we don't feel too overwhelmed. You basically have, these are the most commonly seen classes of eye drops that we see in a pharmacy, and they all have slightly different side effect profiles because of where they work and how they work. So the very first class are beta blockers. Some patients might be familiar with these because they have been around for quite a long time, and they can be used for all different sorts of medical conditions. They can be used for blood pressure. Some people will use them to help with before public speaking, which is increasingly common with Zoom. And some of the things that can happen with these eye drops is that you can get a slight drop in your blood pressure. Once again, it's all about how you're using the actual drops. Some patients will find that you can get a little dip if you're instilling the drops in properly and you're also putting your finger right on the corner of that eye, which I'm sure you all know how to do that. You're less likely to get those issues. Some patients find that their asthma might be affected by beta blockers, so they're not always picked as a first line. But in some cases, it's all about managing the patient in the whole context. So if this is the only thing that will work, it comes down to working as a team with all of your medical specialists and your GP to make sure that the medication does what it needs to do without causing additional side effects. So with these, there's lots of different ones out on the market. Some of you will probably go back and have a look at your little bottles, and some of these medications, I don't put all the brand names in because there's just far too many, but some patients will be quite familiar with these. So they've been used for quite a long time. The second class are the prostaglandin, I've incorrectly spelled that, put an extra G at the end, analogues. And what they do is they increase the flow out of the fluid in the eye, so to speak. So that's how it decreases the pressure. These ones are very, very interesting, and I remember when I was a young student, I loved the idea of these medications because they did very interesting things. They can change the colour of your iris, so that's the coloured part of your eye. It seems I have disappeared off your Zoom, but that's okay. You don't need to see me anyway. You just listen to my lovely voice. So iris pigmentation. So basically the iris is for simplicity's sake, the coloured part of your eye. So it can change the colour of your iris, and that tends to be not reversible. But that being said, some patients don't seem to mind that. The second thing that can occur is your eyelashes might start to grow a bit longer, and lots of people are quite happy about that. I remember certainly as a student, I thought this was a fantastic side effect, because most things have, most side effects are considered to be a really terrible and awful thing. But for some patients, they're actually very happy that they have slightly longer eyelashes. So that's something that's quite interesting with these medications. You can also sometimes get changes in the tissue around the eye. So around the eyelid, you can sometimes get a little bit of darkening or deepening of that upper eyelid. So it might just change the shape. How some patients think of it as potentially some puffiness maybe on the top of the eye. It tends to be something that's progressive, and not everybody gets it. So yep, I'm just getting some lovely messages here, and I'll get to those in a minute. I haven't forgotten about you. So those are the more interesting ones that I'll touch base on again later on in some questions, because I've had some very interesting questions about these types of medicines. The next type are the alpha agonists, and they decrease the amount of fluid that's actually made, and they also very cleverly increase the flow out of this fluid. Generally with these ones, you might find that dry mouth and a dry nose can be something that you can see. Not all patients get these effects though. And lastly, this very, very long class of medications called carbonic anhydrase inhibitors. They decrease the amount of fluid that's produced. So you can sometimes get, it's primarily stinging when you put them in. It tends to pass fairly quickly, but you can also get a little bit of blurred vision as well. So before this session, I was sent a fair few questions, and I'll just quickly go through those. Now, the thing I always tell patients with side effects is you might get one, you might get nothing, you might get everything. That's pretty rare, and it's really unusual to ever really see. So that's why I always say to patients, it's very important that you start from the beginning of your information leaflets, because and also to talk to your pharmacist or your optometrist and ophthalmologist, because we're here to basically walk you through these lists. A list is just a list. It's important to understand it in the context of the medication that you're using. So the very first question we get asked, I actually get asked this a fair bit. Even you could probably pop the time pharmacist in there as well. It's why do we want to know about your medications that have seemingly nothing to do with your eyes? It's not because we're nosy, I promise it really isn't. It's not because we just want to make your life tricky, and because we want to know everything about you. We like to know you as people as well. But the reason we need a list of your medications is because we want to treat you as a person and not merely just as a set of eyes. So it gives the person a more complete picture of you as a patient, of all of the things that can influence your eye health, and of everything else in terms of other medications that you're taking that might interact with eye drops, other medications that you're taking that may affect the pressure in the eye, because they do exist. And are there other things that you're using that might interact with the eye drops potentially that could be prescribed? The same way that you'd probably want to know if the patient was a contact lens wearer. It's all about treating you as a whole person, and that's really, really important in healthcare, is that we don't just fix one little problem, we think of you as an entirety. So that's why we're asking, and it is definitely not because we are nosy. Now, this next question that we get um, is about antidepressants, and you'll probably see if you read the information leaflets um, that sometimes the word glaucoma might pop up in the list of in the instruction booklet, saying that it's not suitable for a person with glaucoma. Um, Once again, we come back to, we treat the whole patient. So we have to consider, before prescribing medications or dispensing medications, or even giving you something over the counter in a pharmacy, what that effect could have for you as a whole. So some of the medications, like antidepressants, can basically interact in an area that has been found to increase or contribute to an increase in pressure in the eye. So it's not necessarily a case of if you have glaucoma that you can't take antidepressants. It's more about how we monitor this. So that's why I know, for those of you who've had glaucoma for quite a while, it's very, very important that you're probably in a very good rhythm of seeing your optometrist regularly, seeing your ophthalmologist regularly, and we all work as a team to try and make sure that if we're going to give you anything, that we're not going to cause any further problems. Part of the reason maybe your GP and ophthalmologist aren't as concerned is because there is we encourage you to basically have that good rhythm of making sure that you're being regularly monitored. Some of these antidepressants, although we know they can, in theory, increase the intraocular pressure, it's a question of how much and that individual patient and the risk for that patient. So it's not that they don't care, it's just we weigh up lots of different things when making decisions, for that treatment to be presented to the patient. So hay fever and allergies is another interesting one that we get lots of questions about. I live in Canberra, so for those of you Zoom sort of joining us from Canberra, you'll understand that hay fever and allergies are part and parcel of living here. And certainly it's what makes this place fabulous, but it can cause a little bit of problem for us, especially come springtime and after rains and high winds. So there are some antihistamines that are not as ideal for a patient with glaucoma. The newer antihistamines are less likely to give you problems. The reason we do ask is because when we ask you questions about, do you have glaucoma, is because there are some antihistamines that can basically bind to an area where it can, as a flow-on effect, cause an increase in pressure. So we do ask you, it's once again not because we're nosy, we just want to make sure that we're going to give you something that's appropriate, that isn't going to make your glaucoma worse, because that certainly would be very unfortunate if, in treating hay fever and allergies, that occurred to the patient. So older style antihistamines are probably a little bit more problematic in that way. So a lot of the very sedating type antihistamines that are quite potent are more likely to fall into that category, where they're probably not our first choice. So nasal sprays are, I guess, the next follow-on, because hay fever and seemingly sinusitis, they seem to have their peaks over springtime, and even in this transition period into autumn. So nasal sprays with steroids, they can, like all steroids, the concern that we have is that steroids can increase intraocular pressure. So it's a case by case assessment. I don't usually say to patients, and patients who are happy to come to me and actually have this discussion, it's important to discuss that if you were to use it, it would be something you'd have to have a chat with your optometrist about as well, or your ophthalmologist. There are some ophthalmologists who don't recommend that you use it. And obviously, we always try and find some other method to try and help with the sinusitis that isn't necessarily a nasal spray. Um, Now, this one is also very interesting. So asthma, another thing that we see a lot of, especially in the last 18 months. We've had lots of people who've never really realised they've had asthma and have recently discovered this. Um, you can, so is an asthma puffer harmful? Because we do use steroids. So what I tell patients is it's about how you use the medication. Once again, we have to think about you as a whole. We don't want to just let your asthma run out of control because we're concerned about the rise in intraocular pressure being a big side effect. So I say to patients, it's about how you use your puffers. It's still important to breathe. It's as important to breathe as it is to see. So I think the important thing is after you use your steroid inhaler, please rinse your mouth. If you're rinsing your mouth out, you're not going to have that steroid sitting inside your mouth where it will get absorbed. So when it goes into your lungs, it's going down into your lungs. Sometimes you get a bit of medication still sitting in your mouth. If you rinse it out and give everything good clean afterwards, that's usually helpful enough to be able to get rid of all that excess steroids. Once again, if you are using a puffer, we want you to be telling your ophthalmologist, your optometrist, your GP that this is part of your regimen. It's very important in that way. And I get this question. So someone's starting a new eye drop and they're worried about this very long list of side effects. Like I've explained, the list of side effects can be very, very long. The reason that is because for some of these medications, they've also been around for a very long time. So these long lists, you may get some of the side effects, you may not. Some of the side effects are common, and as a general rule, as you work your way down the list, they become less common, but they are there so that you are informed about things that can happen. Because I think that being educated and being aware is so important for the patient. So I always say, don't throw out these pieces of paper, keep them somewhere safe so you can come back to them at a later point. Um, you know, I think it's great that people do read that list, but it's so that you are aware. And it doesn't mean that you're going to get every side effect that is on that list. Um, this one is my absolute favourite question. And I've been practicing for over 10 years, and in my 10 years, I've never been asked this question until 2 days ago. And I had to have a little bit of a chuckle um, because I'd never had anyone ask me, even though it's, I must admit, a secret question I've asked myself. Um, so, should you use somebody's glaucoma drops to get some long lashes? This lovely young lady had asked me, can we use these drops? And I could dip um, my mascara applicator in there so that I could have longer eyelashes. My advice would be please don't. and this was the same advice I gave the young lady, was we don't recommend it, mostly because they're not prescribed for you. Um, Medications are prescribed for patients um, for a purpose. We don't encourage. It's a happy side effect that sometimes you can get longer lashes, but we don't recommend people try to self-treat, um, mostly because they're not prescribed for you. They're prescription medicines, and they're designed for mum. So if you're pinching mum's glaucoma medications, there might not be quite enough to get her through the month. So it's best not to borrow somebody else's medications. It's best not to self-treat using mum's medications either, um, mostly because they're not yours. So I thought that was very fitting 2 days ago when I had this person come in. So thank you. It's very, very exciting. Um, Now, I've had lots and lots of questions come in. So I'm just going to pop out of my presentation. Those are my really good friends. So I'll just pop myself back up onto the screen. Um, Now, from Fran, good morning, Fran. If it's still morning, yes, it is. Can my pharmacist help with eye drop installation techniques? Absolutely, we can. So lots of there's also some great resources on the Glaucoma Australia page as well. There are some fantastic videos, and I have to confess, I have actually watched them on multiple occasions because I'm always wanting to make sure that we're doing them properly. So if a pharmacist is not physically handy, either if you're at home or you have someone um, who lives with you or is a carer, and they're not really familiar on how to use eye drops properly. Yes, if you're in the pharmacy, please pop in. We love having people come in and asking us for help. It's what we live for. We also really, really enjoy spending that extra little bit of time to just make sure that your technique is good. There are also other things that, for some of the eye drops, there are some aids that can help the patient put in the eye drops a little bit more effectively as well. So, yeah, absolutely, please do. The pharmacist is always happy to help. You might have to wait a moment or two, but yes, absolutely. I speak for myself, and I know definitely my colleagues who I work with are more than happy to help you do that. Now, oh, I'm getting lots and lots of messages here. So, from Sarah, good morning. Myself and my three sons have glaucoma, and we've tried lots of different eye drops, but none have helped to lower the pressure. Is that common? Um, I would say it depends. Glaucoma is one of those things where, how I describe it to patients, it's almost like Goldilocks. You you know, the first thing you try might not be quite right. The second thing you try might not be quite right. It takes a little bit of trial and error um, to find the right um, mixture of medications. Or I haven't, in my experience, had patients not respond, but it is possible, I suppose. But it's a case of something that I get patients to have a chat with their ophthalmologist about, because things are always changing. Um, Drops work for one drop might work really well for one person, and it doesn't work very well for another. So I'd say don't be disheartened. I would say patience and giving a little bit of time and a little bit of trial and error. Hopefully that finds the right mix for you. Let's have a look. So from Connor, good morning. All eye drops except for Gamfor can give me severe side effects. Is that normal? Um, it depends. So we're all plumbed differently, is how I sort of explain how medicine works. So some patients, depending on, uh, lots of different things like kidney function, if we're talking about even just medicines like tablets, things like, your kidney function, your liver function, these are all things, and our very minor sort of genetic quirks, I guess, can also influence how medications work in our body. So sometimes it is possible that you can find that some medications react better for you and others not so much. The same way that I guess patients can respond better to some medications and not as well to others. So thanks for your question. Let's have a look. So Jenny asks, is itchy skin and runny nose a possible side effect of glaucoma eye drops? Yes, it is possible. So itchy skin, you sometimes can get some irritation, especially in the periocular area, which is the area that's around your eyes. So that's your eyelids, that little patch just down here. Sometimes can get irritation. That's not unusual to see. In terms of runny nose, it is sometimes a side effect of some of the medications. Not all of them, but it is a possible side effect. It depends on what you choose to do about it, I guess, depends on your discussions with your ophthalmologist and with your optometrist as well, as to how you respond to those side effects and how how much they're impacting you, as to what options you may have. Sometimes it might not necessarily be the actual medication itself. It sometimes can even be the preservatives that are inside the eye drops that can cause a little bit of irritation. So it's definitely something that you want to have open discussions with your ophthalmologist about. Now, so we've got a couple more. So from Jill, you use some prednisolone fort and some Azote. Can hot flushes be caused by these eye drops? Hot flushes are the worst, from what I've been told. I've not had the pleasure of having them, but from all experiences that everyone tells me that they're the most awful things in the world. And I haven't actually had patients, tell me this is a common thing that they see. I've never had anyone report this to me, but that being said, I probably have to look into that for you. That's a nice curly one, so that'll be my afternoon task. But I'm not familiar with these being a common side effect of these eye drops. Now let's have a little look. So from John, our little one is age 5 months, congratulations, is on Diamox. So can this affect growth? So Diamox is a little bit different to what we would normally see in a community pharmacy. It's primarily a tablet, or that's usually what we would have it in on our shelves. In terms of growth, that's something that I would probably be having a chat with your pediatrician about, in terms of meeting sort of weight, height, or length growth parameters. So that's something that it's a little bit on the edge of what I've got experience with. So I can't make a specific comment on that. But that's probably something that I would be having your pediatrician and the ophthalmologist have a little bit of a collaboration about, because especially with children at 5 months, there's still quite a lot of growing that they've got to do. So that's definitely something that will need close monitoring. Your pharmacist can help with that in a more general sense, but with specifics, that's something that we'd have to work much more collaboratively with your pediatrics team for your little girl. So those are all the questions I've got so far. I'm sure if you do have more questions, you can pop them up on the Facebook page. I'm going to go and do some more research on hot flushes, because I've had lots and lots of questions about hot flushes in the pharmacy of late. Um, so that's something a bit interesting. I look forward to learning a bit more. Maybe I could share it with you in a comment later. But thank you so much for tuning in today. I'm loving these fabulous questions, and hopefully everyone can stay safe. And we look forward to your next live session. Um, Khan is one of my pharmacist colleagues on our committee, and I think she'll be touching base maybe later on tonight, and I think it's going to be a goodie, so I'll probably tune in for that as well. So have a great rest of the day, and stay safe. See you.